All right. Good morning, good afternoon, good evening, wherever you are. Welcome to Black Mental Health Matters Show podcast. And my name is Elsa Akwork, and I'll be host today on a very special topic on addictions and mental health. And this is such a great and needed topic, especially how it intersects with Black communities and their well being as well. And just want to quickly say that today is also International Men's Day, which is a day to recognize the cultural, political, and socioeconomic achievements of men. And this is so nice, especially with our Black men as well. So, with that said, I am very excited to host our special guest today, Keisha Brown. And Keisha, you are a licensed clinical psychologist in the mental health field. So, if you can please, first of all, welcome. Um,
Yeah.
and if you can please introduce yourself, tell us who you are, tell us about you, where you're located, what you do, and why you do what you do.
Okay. Well, I'm Keisha Brown, and I'm a licensed professional counselor and a licensed substance abuse treatment practitioner. I'm located in the United States, in Virginia. I currently work at a psych hospital. I work with psych patients, and I love what I do. I've been licensed as a LPC for 10 years now, and I've been working in the mental health field for a little over 20 years. So I am so happy to be here with you all, and I hope I can help more in the future in any way that I can.
Well, you absolutely can. And thank you so much for joining us today and taking the time as well. And what an amazing correlate that you have. Like with 20 years of mental health experience is so much needed, especially for our community. So we're very glad to have you here
Thank
today.
you.
And so today we're talking about addiction and mental health. I think it's one of my favorite topics just because talking about addictions, which is a different thing in and of its own, and we also have the mental health component. So, and it's very crucial because there are so many layers to it that hopefully we'll try to uncover today. Like, for example, I just read somewhere that people with mental illnesses are twice likely to have substance use disorder compared to the general population. And at least 20% of people with a mental health illness have a co-occurring substance use disorder. So we can really tackle this topic many different ways, from the mental illness aspect or from addictive um, things that are susceptible to addiction that can cause mental health abnormalities or mental imbalances. So, there's just so many things that are related to mental illnesses. Like I said, there's also mental health problems that occur from addiction and addictive patterns and behavior as well. So, we will hopefully be able to dive into some of these topics, some of these intersectionalities, and also getting to know, what causes addiction, how it affects our mental health, and are they related to mental health illnesses. So, with that said, let's begin by actually diving into the concept and understanding what it is that we're trying to say. So, my first question to you, Keisha, is what is addiction?
Well, addiction, it's the fact or condition of being addicted to a particular substance, thing, or activity.
Mhm.
Yeah. I'm sorry. Were you about to say something?
No, I was going to say, like how you said, um, pattern, substance, or activity, because we also have addictive behaviors. I think addiction is always associated with substance. I think that's the first thing we equate it to. So that's a good way of putting it. So, do you think, what are some of the most common things that lead to addiction?
Oh, wow. There's quite a few things, but on the top of my head, I would say that peer pressure,
Mhm,
physical, mental abuse, sexual abuse,
mhm,
um, early exposure to drugs. If
mhm.
you're raised in an environment where smoking marijuana or drinking alcohol is the norm, that can be a common thing that can lead to addiction and also mental illness.
Right, right. And there's just so many layers to that, like I said. So, do you think there's such thing as good versus bad addiction? I say this because coffee is addiction. So, is there such thing as a good and a bad addiction or addictive behaviors, I guess?
I think that all addictions are bad. And my reason is if you don't use things in moderation, you know,
Hmm.
become bad for you. Okay, so we know that substance abuse and alcohol abuse can lead to many health issues and cause a life of turmoil. But we would think that eating healthy and exercising a lot will be a good thing. Okay, so if you're eating a lot of vegetables and you're not adding any protein, your body can be losing protein, so that can be harmful. If you're constantly exercising and to the point that you injure yourself, that can be harmful.
Right.
So yeah, I think as long as we're using um things that's supposed to benefit us in moderation, that's fine. But when anything becomes an addiction, I think it's harmful.
Okay, that's a good way of putting it. So in that case, then talking about harm and how that can harm our mental health, what is the connection between mental health and addiction?
Okay. Well, mental illness can contribute to drug use
Mhm.
and addiction. People with mental illnesses may self-medicate
Mhm.
to take care of themselves to feel better. You know, when someone is feeling depressed, they might self-medicate with marijuana, or if someone with ADHD needs something to help them stay calm, they might self-medicate with alcohol. So
Mhm.
yeah, I think that's the connection.
Okay, so in that sense, then addiction can be classified as a mental illness?
Um, yes, I think so.
Okay.
Yes, I consider both a complex brain disorder and a mental illness.
Mhm. In that
Yes.
case, then, so in your experience as and in your field, what mental illness is most associated with addiction, or what mental illnesses are mostly associated with addiction?
I noticed a lot of patients that's dealing with psychosis,
Mhm.
they will try to self-medicate. I noticed that they um, will like to self-medicate with cocaine or crack cocaine, and a lot of them smoke cigarettes as well. ADHD, I've seen some ADHD patients, some borderline personality. A lot of the personality disorders will do the same thing, as well as antisocial personality disorder.
Mhm. And are there like repeated patterns with, how can addiction or patterns of addictive behavior affect our mental health?
Yeah, if you or someone you care about is chronically using drugs or alcohol, it can lead to changes in their brain, which can lead to mental health issues. They can become paranoid, depressed, have anxiety, aggression, hallucinations, and other problems.
Oh, okay.
Yeah.
So in your experience then, from what are the chances, I guess this is I guess out of the scope of what I wanted to ask, but are there like high returners of those with those behaviors coming into seeking like mental health services from you than those that are first time abusers of substance abuse or other addictive behaviors?
I see a lot of returners that are, have psychosis diagnosis, um, bipolar diagnosis,
Mhm.
a lot of dual diagnosis. Yeah, they're constantly returning. Yeah.
Mhm. So would there be like repeated, so if they come in for one mental health problem with overuse of a certain substance, could they develop another mental illness in your experience or?
Yeah, they can yeah, if they're dealing with ADHD and they're not following through with treatment, they're not going to their follow-up appointments or taking their medication, yeah, they can end up having depression and
Mhm.
anxiety. Yeah, so there's other mental health issues that can come along because of not focusing on treatment, not completing treatment, not doing what they need to do to help themselves.
So how is that? So those that self-medicate, I guess, is there like a harm in that? And what is the harm that causes that to further develop other behaviors besides addiction? Because a lot of the people that I notice too are trying to self-medicate because they think it's a treatable problem and not a reoccurring one. So
Well, yeah, other than the addiction, it can cause them to have some physical conditions as well. They can have smoking cocaine can cause them to have heart issues, and it can cause their blood pressure to be high. It can cause a lot of physical health issues. Yeah.
right. Because I think when we talk about mental health, sometimes we separate it to say, psychosis is a mental health problem, but I don't want to say just misdiagnosis, but also trying to self-medicate certain problems could also have harm in the physical aspect. And I see even in previous like mental health services that I worked at, where they come in for one thing, but they could have 5, 6 different things in return, and then it could have like a dire physical effect. So, it's just interesting to see it from a therapist's perspective. So, I guess my next question to you, Keisha, is in the past, attention epidemic, because I want to bring this back to Black mental health and how it affects Black men. Now that we've defined some of these concepts and some parallelisms between mental health, mental illnesses, and addiction or addictive behaviors. So in the past, attention epidemic has focused primarily, obviously, on white suburban and rural communities, and which has been less so on Black communities. Could also be experiencing similar problems, if not more. For various reasons. So, do you think that there is a lack of commitment in addiction and mental health resources for Black communities today?
Yeah, while all communities face mental health and addiction challenges, I feel that Black communities often deal with a lack of resources,
Right.
including high cost or no insurance coverage, limited options, and long waits to get into services, lack of awareness and education, and
Mm-hmm.
then there's a big social stigma for Black people when they're trying to help themselves when they're having issues with substance abuse and mental health.
Right. And I agree with that as well. I think it's because when we talked about mental health resources and the way you put it as well, these resources were not available to Black communities in the first place, in addition to having all the other factors that prevents them from accessing these mental health services, such as lack of awareness. Could also be socioeconomic status. It's mental health services are costly, and resources don't come cheap as well. I mean, now I think there's more affordable options, and in the day and age of technology, I think there's things like mental health apps that I hope are people using them for. But even with, and I said today, it's because if we track back even 5 years ago, technology didn't. Yeah, we still had internet, but we didn't have a lot more services than we do now. So has there been any change, or has there been any progress, even from your experience?
Yeah, I think there's been some progress. There's a lot of educational programs, a lot of treatment centers popping up, especially for the opiate epidemic.
Mm-hmm.
Yeah, so now insurances are being a lot lax and allowing, people to get coverage. If at one time only pregnant women and women with children could get Medicaid, and now men are able to utilize that resource. So I do think things are moving in a better direction, and but a lot of people are still under the radar. They're being missed. They're not connecting to the resources, and it needs to be a more of an outreach to bring awareness so more people can know about these services and utilize them.
No, I absolutely agree. I think when it comes to outreach, that's one thing that community support and family support is direly needed, because I think we talked about it a bit before we started the show, is that there's this stigma associated with wanting to access, admitting even mental health problem in Black communities. And I guess just a quick question, just in addition to that, for your experience, is that do you see a lot more minority groups? I just want to just broaden a little bit, coming into you for therapeutic services, and if so, have you seen an increase in more a diverse group coming to you for mental health services as opposed to the white community per se?
Yes, I have. I've seen more people of color, and a large percent of men are now coming in for services, for mental health services and counseling. And at one time, I barely saw men, and it was like to ask for help, to ask for mental health or addiction treatment is admitting to having a weakness.
Mm-hmm.
So a lot of men, stay clear of that. But now I see a lot coming forward and asking for assistance.
Mm-hmm.
So, yeah.
I mean, that's actually I don't know, that it's nice to see that progress. And I call it progress because I think there's a lot of stigma associated with men. I think it's a lot more than it is for women, because women were, I think, socially taught to express ourselves, so we're more likely to open up to our problems and or with regards to our problems. So and I actually just did the show last week on technology. And I think I remember one of my guests saying that he's actually seeing a lot more frequent men using mental health apps to access mental health services, which I think is really kind of interesting because, of course, with mental health apps, you're creating that, there's a disconnect of not wanting to reach out to a therapist like you face to face, but they're more comfortable at least accessing a mental health service, which I think is still good in my space, in my head, just because I come from a cultural background where men are not even expressive about emotions, let alone mental health challenges. So it's nice to see that progress, and hopefully it continues that way and it can go that direction. So, which leads to my next question, is that how can a family member or a community, especially Black communities, what can they do when one of their own or one of their loved one is struggling with addiction? How can they encourage better care and accessing and mental health services?
Before I get to that question, I wanted to piggyback a little bit more about what you said about the apps and people finding more resources from apps. I also, I felt like one of the good things that came out of the pandemic was a lot of health services was offered virtually.
Right.
Yeah, so that really allowed people, men and women of color, to access these resources for mental health and addiction therapy and treatments from the comfort of their living room. You know, that increased the confidentiality. No one knew that they were seeing a therapist that was receiving this treatment. They were able to receive services and get the help they needed so they can start on the road to sobriety. So yeah, I agree with you. Having the apps and the virtual spaces where therapists can provide therapy, yeah, it's really an awesome outcome from the pandemic.
This is coming from a therapist yourself, so that's a good thing to hear. And I think it's because you're right, though. It reduces that socioeconomic struggle as well, having to go access, because there's a lot of costs associated with wanting to go to a therapist. And especially in culture, Black culture in and of itself is, there's still that stigma, even though we talked about mental health. There's still that stigma embedded in men, especially, that if they are seen, you mentioned earlier, it's a sign of weakness to seek a mental health a mental health service or to see a therapist. So in the comfort of their own home, at least they're able to virtually experience themselves. And you're right, that is one good thing that came out of the pandemic, and also a lot of virtual health services that are happening. And I'm also seeing that change in some countries in Africa as well, and that it's becoming like a big thing, that it's like, oh, I can do this from my home. Like I don't actually have to go express my feelings. I can just express my feeling here, which I think creates a more comfortable space. Because when I think of when I used to think of mental health services, I think of like that Freudian chair, having to sit there and cry your eyes out. Not that but now it's just sit in your own couch, have your coffee, and you can talk about, you're more willing to talk about what it is that's bothering you, and knowing that there's someone else that's listening out there. So bad COVID, but also before.
Yeah.
So
exactly.
Yeah, that's a good point that you have out there. So with that said, then how can we encourage our communities to
we can encourage our loved one or the individual to seek help. To seek help. This may include finding treatment resources for them, finding a therapist who specializes in addiction counseling, and getting help for your loved ones. But we also need to understand that the loved one of the person who has the addiction also needs support. I feel like if there's someone in search of services because their son is abusing drugs, that mom or dad needs some resources and support as well. So, they can be referred to resources. We can set better examples, have a healthier living and pretty much giving up recreational drugs and alcohol, and to be sober and have that just be that person that's showing them a clean, healthy life, to be that positive role model.
Right. I mean, you really highlighted that the main thing there is that the support that we're providing, and I see it through like parents, even my parents themselves, they're also people susceptible of, their own problems. So to provide that support for them. And I think that's the most crucial part, because the support needs to support themselves. And they are the unsung heroes as well, right? Because I mean, I just asked, what can we do as a person if we see someone struggle? But we also need that help so that we have the right tools and the right support, so that we can be able to better help the person in need. And so as in your profession, then as a therapist, what's your advice when it comes to someone who's struggling with their mental health due to addiction?
My advice would be to get treatment. Yeah. Just to reach out to a therapist or even their PCP, because they may need medication to help with mental health issues, so they won't have to self-medicate. They may need individual and or group counseling, individual counseling one-on-one with a therapist, to sit down and talk about struggles, talk about goals, discuss interventions to help them. They may need a group therapy, which consists of a support, a community, of people who have been through or are going through what they're going through. So that person would know that they're not alone in this. This is something that's been going on and happening in their community to others. So they'll have that support, that sense of support. Yeah, that's the type of advice that I would offer them, is to get help. Don't give up. Try not to allow any type of stigma discourage that person. Try to be really encouraging and supportive.
Yeah, that's a very good takeaway. I think especially that they're not alone. I think because mental health problems, whether caused by addictions or not, that it makes you feel isolated and it makes you feel very alone. So it's nice to at least to encourage better care, to say that, you're not alone yet. Yes, you're going through it alone, but there's also this support system behind you. So I know we're crunched on time today. We're very grateful to have you today, Keisha. Hopefully we'll have you for more topics. I really want to dive into this topic more further. So hopefully we'll come back and we can talk about it more. But what is your takeaway message for today's topic, from your experience?
My takeaway would be to be supportive and just be kind to people, because we never know what someone's struggle is, what someone is going through. Just a friendly smile, a hello, you know, and if you see somebody that needs help, if you can point them in the right direction, that would be awesome. Just we need to start loving everyone, because we're all human, and we just need to be there for each other and be a support and a love for each other. Yes.
Yeah. That's a simple, very, very profound message, and that's all we need at the end of the day. We're humans, and a simple smile can go a long way. So thank you so much. And where can people find you, Keisha?
Okay, well, they can find me. Let me see. They can give me a call. I do private practice counseling, Brighter Dawn Counseling Services. They can Google that and get my information, or they can give me a call at 434-250-0081. That's my office cell number, so they can contact me that way. And yes, I have slots available. So if someone needs some therapy or some addiction counseling treatment, please get in touch with me.
That sounds great. Thank you so much for answering all our questions today, and at least we uncovered some parts of. I think this is such a huge topic. Like I said, two of them could be discussed in their own realm, and to be able to create that intersectionality, especially for Black communities, is so essential. But yeah, and we're very grateful that you were able to join us today, even for a short time. We're very much appreciated. Thank you so much, and you have yourself a very wonderful day, Keisha.
Thank you, and you do the same.
Thank you. Bye.